This week on the podcast, I'm joined by Paula Miller of the Adult Congenital Heart Association. And as you can expect, we discuss congenital heart defects, how they're impacting adults, how they're impacting children. And we break it down into layman's terms, so regardless if someone in your life has one or not, you can understand it. Here's what you can expect from this week's episode of People You Should Know podcast.
You can think of the heart as like a house. It has 4 rooms, and those are the ventricles and the atrium. And the atrium are at the top. They're the 2 top rooms, let's say the upstairs rooms, and at the bottom are the 2 ventricles. And then in between those are doors, which are your valves. And then there's also valves that go out to the lungs and to the rest of the body. Mm-hmm. And so in congenital heart disease, or if you have a congenital heart defect, and sometimes those terms are used interchangeably, the problem is going to be there's going to be something either wrong with the rooms or the walls between the rooms. There may be a hole in the walls between the rooms. The doors or the valves may either be narrowed or they may be too large. Sometimes those rooms are backwards, so maybe your left side of your heart has been switched with your right side of the heart, and so blood is going not in the right place out of those valves and those arteries and coming back in with those veins. Or in some instances, part of the heart is underdeveloped, and so children might be born with what we call a single ventricle, in which one of the ventricles, either that's the bottom chambers, one or the other might be underdeveloped, and so they just have one side of their heart that's functioning.
Subscribe to People You Should Know podcast on iTunes and Google Play. To learn more, visit BillCoonspeaks.com/podcast.